Good morning, everyone. My name is Rubina, and I honor to present the research title, The Role of Artificial Intelligence in Personalized Nursing Care for Chronic Disease Management at Home. Here is the outline of my presentation: introduction, problem statement, objective, literature review, research methodology, results, decision, and conclusion. Here is being with an introduction. Chronic illness like diabetes, cardiovascular disease, and cancer are major causes of death and disability worldwide. According to the World Health Organization 2022, 71% of global deaths are due to chronic diseases. To manage these conditions, the focus is shifted from hospital-based care to home-based approaches, improving patient self-management and reducing healthcare costs. Artificial intelligence is emerging as a transformative technology to support personalized nursing, particularly for chronic disease management at home. AI tools like virtual health assistant and predictive analytics enable remote monitoring, early detection of health declines, and timely intervention. The use of AI in nursing care is one of the evolutionary changes in the management of chronic diseases outside healthcare facilities. The problem statement: chronic disease requires continuous management and monitoring, which can be challenging for patients at home. Traditional care approaches often lack real-time data and predictive insights, leading to delayed intervention and poor health outcomes. There is a need for innovation solutions to support nursing in delivering high-quality personalized care to patients with chronic disease at home. Leverage artificial intelligence to enhance personalized nursing care for chronic disease management at home, improving patient outcome and nursing efficiency. The research question is, how can AI be based to individualize the nursing process in patients with chronic illness at home? How do people perceive the advantages and disadvantages of applying AI in the home-based nursing practice? How is the AI-based nursing care model capable for producing better patient outcome in chronic disease management? Here is the literature review. The research methodology. The study implied a mixed method design combining systematic and literature review with qualitative interviews. The systematic review identifies current AI trends in care, while interviews provide insight into real-world usage, perceptions, and challenges faced by nurses and patients. This hybrid approach enhances study validity and depth by integrating empirical and experimental data. Inclusion criteria include English language studies on AI in home-based nursing care for adults with chronic illness after screening 245 abstracts using the PRISMA framework. 36 studies were selected for full review. The research methodology is: the qualitative stage involved semi-structured interview with 12 registered nurses and 10 patients using AI-enhanced chronic care at home. Interviews explored topics such as care personalization, nursing-patient interaction, clinic decision-making, and patient engagement in the context of AI-supported care. Each participant signed an informed consent, and permission to conduct the study was given by the University Research Ethical Committee. Research methodology: how the data analysis. Data analysis was conducted in the two parts: descriptive synthesis of quantitative data from the systematic review to identify AI features and outcome, and thematic analysis of qualitative interview using Burn and Clark model. The qualitative data was managed using NVivo software with inductive coding to identify themes on usability, effectiveness, and ethics. Triangulation of results from both strands was used to cross-validate insight and strengthen findings. The result is the analysis showed that AI technologies effectively enhance personalized care for chronic diseases management at home. AI tools such as early warning algorithm and remote monitoring enable nurses to address issues early, improving treatment compliance, reducing emergency visits, and increasing symptoms monitoring accuracy. Nurses reported that AI reduced time spent on surveillance and reporting, allowing them to focus on care planning, patient education, and emotional support. However, they emphasized the need for training to interpret AI-generated data and avoid over-reliance on AI suggestions. A result of these studies, on the patient side, a significant number of people enjoyed an enlarged sense of security. The constant feeling of being looked at and individual responses that systems powered by AI afford them. They were more confident when handling their conditions, and the instant feedback mechanism of virtual assistant and wearable device. Discussion: the study results align with existing current researchers, confirming AI's potentials to enhance chronic diseases management at home by improving clinical decision-making, early complication detection, and individualization interventions through predictive analytics and virtual health assistance. This study highlights that AI effectiveness in home-based care depends not only on its capabilities, but also on this integration into nursing practice and alignment with patient needs. AI has transformed nurses' roles from task-oriented care provider to data-driven care coordinator and patient advocates. This shift enables nurses to focus on interpreting AI-generated insight, making complex decisions, and engaging patients in shared decision-making and self-management, ultimately boosting patient confidence and independence. Some nurses expressed concern about over-relying on AI algorithms, emphasizing the need for continuous professional development to ensure AI complements clinical judgment. Conclusion: this paper concludes that AI can revolution personalized nursing care for chronic diseases management at home by enabling early complication detection, improving patient compliance, and enhance patient-centered care. To achieve this, nurses need training to work with a system while maintaining the humanistic side of care. Policymakers must ensure AI-enhanced nursing work and compliance with data safety and fairness principles. Healthcare systems should invest in training, infrastructure, and inclusive design to make AI tools accessible. Future research should focus on the long-term effectiveness of AI-assisted home care and its impact on nurse-patient relationship, cost, and quality of life. The references of the presentation is this.